Today, we wanted to make sure that you understand and left with an idea, and you could provide to the people of Oklahoma an idea of what the appropriate use is for the emergency room. Right now, you've probably heard of the concept of flattening the curve. You see that there's this spike that will occur with COVID illness in the community as it starts to get into the community. And we want to flatten that out so we have the capacity as a medical community to provide the care for people that will be coming to us. And so what we've done is we have organized ourselves and ramped ourselves down so that we can be prepared for the inevitable people that will be coming for care. With that, I've brought here several medical providers who will be the experts here. Dr. David Chanslem, who I'll be handing the microphone off to next. He is the medical director for infectious disease here at INTEGRIS Health. And we'll also turn the time over after him to Dr. Tommy Ibrahim, who's the chief physician exec for INTEGRIS Health. So thank you for being here, Dr. Chanslem.
Thank you, Mr. Pearson. My name is David Chanslem. I'm the medical director of infection prevention for INTEGRIS Health. And we're going to talk about 4 things today. Things that we as a community can do to try and flatten that curve. We have been saying it for a while now. The most important 2 components of making this COVID pandemic manageable are social distancing and hand hygiene. Social distancing is something that none of us had really heard about until last couple of 3 weeks, right? And it is a new concept. That's not a new concept, but it's a concept that the only way to really prevent the spread of the contagion is to not be near somebody with it. So as we talk about before, social distancing meant maybe not let people around you that have been to certain places where COVID was active. It's active in Oklahoma now. So it's important here. It's not just in Seattle or in New Rochelle, New York. It's here. So it's important that the actions we take today will help to change the course of the pandemic as it becomes more and more problematic in our state. For social distancing, distances of 6 feet from really the people around you, but also staying home as much as you can. If it is not absolutely essential that you go out and do things, try to stay home as much as you can. Everybody that says, I'm just going to run out and go do this quick errand is doing a disservice to their neighbors and doing a disservice to everybody else. It's not just okay to run and do this one thing. Try as much as possible to stay home, work from home, and accomplish as much as you can there. Hand hygiene, talk for a second about that. Hand hygiene, we've been telling them since kindergarten, wash your hands, right? How do you do it? 20 seconds, hot water and soap, preferably liquid soap, better than bar or powder soap. Alcohol hand sanitizer, at least 60% alcohol if soap and water isn't available. Soap and water is preferred, but alcohol hand sanitizer is pretty good and obviously a lot easier to carry around than a sink. We are seeing in many countries play out the worst case scenario. Italy right now has implemented a lot of things and they still haven't seen a drop in cases. So it is important that we start now, before things get awful, that we start now in doing those things to try and keep the hospitals from being overrun with COVID-19 patients. Already in New York, they're talking about bed shortages there as a real possibility. Not having enough beds, not having enough ventilators, not having enough staff. We got to remember that they're humans too. And we have to sometimes think about what the surge capacity would be for our system. We've been talking with doctors from other systems, of course, about what their strategies are here in the city to try and make sure that we are able to take care of the patients that really need it. So the most important things that people can do: stay at home, social distancing, wash your hands, okay? What are the signs and symptoms of COVID? COVID is mostly going to involve a fever. It is cough and shortness of breath. Those are the 3 things that have traditionally been seen with COVID. Unfortunately, those are seen with a lot of different diseases, so it's difficult sometimes to tell. But right now, in the middle of the pandemic, we kind of have to be thinking about that when somebody presents with those sorts of symptoms. If you feel sick, remember, most people that have COVID will not need to be hospitalized. We have all seen different famous people who've had coronavirus or COVID-19 Facebooking from their homes or something like that, and they look healthy, and they are. And most people will be. Our responsibility is to those among us in society who are more fragile, who are immunosuppressed, who are over the age of 60, who might have a lung problem or something like that. Our responsibility is to them. So if you feel a little bit sick, you probably don't need to come to the hospital just to get a test. We'll talk about testing in a little bit, but we want to make sure and follow just good sort of fever care, fluids, acetaminophen, taking things like that to try and manage the illness. And remember, you're unlikely to become grossly ill. If you have difficulty breathing, if you have persistent pain or pressure in your chest, if you have confusion, if you have bluish lips or face, then it might be time, then it's time to come to the emergency room. It's not all inclusive. There are lots of different things that can happen. But for the most part, if you're just running a fever and you're not short of breath, it's best to stay home. If you come, we may not be able to test you because of the limited availability of tests right now. And we really have to preserve our supplies for the patients that are going to require more critical care. If we're having to use supplies for everybody with the fever, then it can be very difficult, and that is probably our second or third biggest, maybe our biggest challenge in trying to get ready for the surge. So I know you guys have a lot of questions about the test. I think Dr. Ibrahim is going to talk about that. So this is Dr. Tommy Ibrahim, INTEGRIS Health Chief Physician Executive, going to talk about testing.
Thank you, Dave, for your leadership and for the work that you're doing to lead us through this crisis that we're dealing with. My name is Dr. Tommy Ibrahim. I am the Chief Physician Executive for INTEGRIS Health, and I did want to speak to you a little bit and sort of expand on what Dr. Jansom has mentioned regarding COVID testing. There does continue to be a worldwide shortage of testing kits due to this unprecedented demand that we're seeing across the country and across the globe. We are working with federal as well as state and local governments to try and rectify this shortage as soon as possible. We do understand that it will take a significant amount of time. Additionally, this worldwide shortage is not just limited to just testing kits. We're also seeing a significant decline in the number of personal protective equipment across our organization, for sure. And this is important because without personal protective gear, it really does put into question and put into significant risk having our caregivers at risk of exposure when coming into contact with patients who may be infected. So it is a significant limiting factor for us as well. When testing kits do become more widely available, we do plan to work with the county health department to open up a drive-through testing clinic, as well as setting up tents across our campus here to ensure that those who wish to be tested do get that test. Again, we want to try to offer testing to all those who need it and want it. In the meantime, as Dr. Jansom had mentioned, we are not able to test everyone who wishes to be tested. We continue to reserve this extremely valuable resource for those who are most significantly and most critically ill. We understand, however, that might not be comforting to those out there. We understand that people are scared. We understand that people are worried about themselves and certainly worried about their loved ones. And we continue to ask the community to be patient and to not to rush to the emergency room to be tested at this time unless the condition does warrant. We are trying to adhere strictly to the CDC guidance on this, and as Dr. Jansom mentioned, those symptoms of most concern include, again, difficulty breathing, shortness of breath, persistent pain or chest pressure, new confusion or inability to arouse, and cyanosis or bluish discoloration of the face or lips. We do advise and do ask our community to try to adhere to those guidelines according to the CDC as well. We need to try to free up our emergency rooms for what they truly are intended for, to take care of significant emergencies. There are other health conditions and chronic conditions in our community that we need to make sure we're available for, and things like heart attacks and other concerning etiologies need to be taken care of in our emergency rooms. We continue to work with the Oklahoma State Health Department and other local labs to expedite the process of getting more testing kits, and we anticipate those to hopefully be coming soon. And once that happens, again, we want to expand our ability to test to all those who want it. And we hope to give as much peace of mind to the community as we can to those that are searching for it. Finally, I do just want to acknowledge the fantastic work that's happening here at INTEGRIS, led by our Chief Nurse, Carrie Bear. Carrie's been leading our response across the organization with an absolutely phenomenal multidisciplinary team. And we as an organization are truly coming together. It's truly amazing to watch the organization rise up to care for the community. And I, for one, can't be more proud of the response that we're seeing here across the health system. So with that, I'd like to turn it over to our President and CEO.
So we want you to know that we are working day and night, not only here, but with the other health systems in the state. We're working with White House officials, with the governor and his team, with the state and the county health departments, to make sure that we are providing a coordinated approach. We are as frustrated about the testing situation as you are, and we're working actively with these officials to make sure that we get the tests that we need for our community. With that, I'd like to invite you to ask any questions of me or our great medical team here. So what questions do you have for us?
How many tests do you all have available? How do you determine who gets those tests?
Yeah, Carrie, Carrie or Dr. Chancellor?
So the first question, how many tests do we have available? We actually don't do testing on site here at INTEGRIS. Those tests, there's only one place in the state right now, and that's the Oklahoma State Department of Health. That's been a rolling allotment of tests. As more become available around the country, they're shunting it to different places. So I actually don't know the number of tests that, at the very beginning of this thing, I think we knew that we got 300 tests. I have no idea how many the state health department has gone through, but we want to be a good steward of their resources by not sending them everybody who comes in with a fever of 101. The second part you said, how do you determine who gets the test? Great question. So the CDC has offered some guidance on that. Essentially, it's going to be people who are over the age of 65 or have other chronic medical conditions. That's probably going to be the biggest. People who are asymptomatic, even if they've been in contact with a known COVID patient, we're not necessarily testing all of those people. The state might from their epidemiology contact tracing department, but those people aren't necessarily being tested. So, we've had many people come in and say, I'm pretty sure I came into contact with somebody, I want to be tested, I feel fine. We're not going to do that because we have to save the resources for later on. One of the most important things about testing to remember is testing isn't going to make the epidemic go away. It's just going to tell you whether or not you got it. What makes the epidemic go away is social distancing and hand washing. So we can test everybody here, and then we can all go out to a restaurant and we're going to test positive tomorrow. You see what I'm saying? So testing is not going to make the epidemic go away. It's going to help us do our job. But even if I had a patient that had a negative test, my advice would be the same. Go home. Social distance. Stay away. So we'll continue to let you guys know as we have more. A lot of the local labs have hubs that they send them to. So DLO, of course, is a big local lab, and their parent company is bringing up more and more testing sites around the nation. But again, it's a reagent problem. It's not necessarily that they don't have the test. It's the recipe to make the test work has been a shortage. It's coming up, but there's been a shortage on it.
So have you seen, especially Oklahoma County, having so many cases in Oklahoma? I'm sorry, I'll yell since I'm so
It's
far
okay.
away from you. I've had a couple people tweet me, message me that they're my age or in their 30s and they're coming in, they're feeling ill, and they are turned away. Do you understand how that is a little bit frustrating for them? But
It's frustrating for all of us, I can promise you. We don't like telling anybody that more than anybody likes hearing that. But they're healthy, they're young, they're going to be okay with this. We've had several positive tests in the state in exactly that demographic, and they are home and they are doing fine. So the rules aren't going to change whether the test is positive or negative, or if it's the flu or anything else. Just because you have, for example, the flu, we still don't want you going out and being around. So long as you're not having some of those other symptoms, the shortness of breath and the bluishness or ultra mental status, you're probably not going to get a test right now. You want to talk about that, Carrie? This is Carrie Bear, the Chief Nursing Officer here for INTEGRIS.
So on an ongoing basis, we have an incident command center set up, and so some of the questions you're asking about testing, we are getting stats at the beginning of our day and then ongoing throughout the day. So we know how many ICU beds we have available, how many ventilators we have available, what our capacity is when we hit surge. We are actively working on a staffing plan. We are working on the potential of setting up tents if we get to that need outside of our hospital system. We have identified multiple locations within our system where we could convert those areas into ICUs. We could convert those areas into med-surg units. We are working on our valuable staffing resources right now, and we're putting together some very strategic ways that we will staff those areas, utilizing our resources as best as we can. And so it's an ongoing process, and again, every day we're getting updates, and we're planning for the worst and hoping for the best.
Is there a timeline on when you all would like to have this drive-through testing of the tents?
We'd love to have those ready today, but to Dr. Chanson's point, we are trying to conserve our PPE, our personal protective equipment, and testing right now. So again, on a daily basis, as we evaluate our availability of those supplies, it's guiding us strategically and scientifically on the direction we go with testing. But the moment we have those tests available and we feel like we can secure that personal protective equipment, we are ready to pop those screening sites up.
At what point does INTEGRIS hit overload? Are you close to that point yet, or kind of where are you at on the scale of, needing those tests? Low?
Right now, we are operating at a very manageable level. The area that we are trying to manage the most is our emergency department. That's an area where we really want to make sure that we're caring for our sick patients. And so when we start getting the walking well and people are there just scared and nervous, that's why we're trying to, kind of plead with the community to the point of Dr. Chanson and Dr. Ibrahim, please stay at home unless you are truly sick. Otherwise, come to the ED. We want to absolutely take care of you. We do have capacity right now. We are working on, appropriately discharging patients and constantly making room and holding beds to make sure that we have capacity for these patients.
So you have seen more people come to ER just like freaking
Yes,
out.
ma'am,
I hate using that
absolutely.
word, but
Yes, we have seen a definite surge in patients just coming because they're scared.
Yeah, just to be clear though, you guys are not able to test anyone too, correct?
We do have testing. We are reserving those for those clinically identified patient populations.
I would say we can take the test. We can do the swab. We just the machine that runs the test isn't on this campus or on any other campus.
And then you do it. Sorry,
Yeah.
You do the swab, and then they come pick it up, or you send it.
Yes. Yeah, that's it. There's a courier. The state has a courier. DLO has a courier. Different mechanisms. Sometimes we'll drive down there ourselves.
Yeah, that was I was getting earlier. How many of those tests are you
So that's the thing is that supply is in short supply too. So the swab that we have to use to scrub the inside of the nose. Sorry.
This is like the most important question of all.
Okay. I'm going to that is part of the problem also. We've been talking a lot about supply shortages for personal protective equipment and things like that, but we're also having supply shortages for the swabs that we use to take the sample. So that's on a back order also for everybody. So we have some of those kits, which again, I don't know that the number of kits that we have even matches up with the number of tests that they have for the state. These are kits that we use for. We're stealing the swabs out of our flu kits, out of the OBGYN clinics. We're taking swabs from wherever we think we can find them so we can have them. But just because I have the swab doesn't mean that the state or DLO or anybody else has a test that has the machine ready to test it. Does that make sense?
So you can swab, but you never see a kit.
Potentially. I mean, if it was right now, we are able to test. Right now, we've been able to send the tests. Some of those tests are taking several days to come back, though. They're being sent off to other places that are kind of prioritizing some of the places where there's more of an outbreak situation, like Seattle or New Rochelle and now New York City. And so they're kind of in a queue because those machines can only run a certain number of tests per day. So as they bring more and more online, and that was part of the stuff that's been going on the last week, is we're trying to see, do we have machines that might be able to be repurposed and retrofitted and things of that nature to see, and people all over the country are doing that. But again, even if you have the machine, you still have to have the stuff to run the test.
Do you have like a ballpark of how many people
that we've administered the test to? I would, across the INTEGRIS system, I'd say maybe 200, 250, maybe. Yeah, just for COVID. Yeah, I mean, we do other testing too. We'll check for flu swabs and things like that to see if something else is there. But just for the COVID testing is mainly what we're interested in right now. We'd love to see more tests, to help all of us. But again, testing is not going to fix the problem. My fear is that we're going to put this drive-through testing center up, and then everybody's going to congregate there, right? So just to get a test. If you have a positive test or if you have a negative test, it doesn't really matter. If you have a negative test today and you feel fine, you might have a positive test tomorrow. If you go somewhere where there's 300 other people, at least one of whom is sick, then it's going to get everybody sick right there, right? So testing is not going to fix the problem. What's going to fix the problem? Washing your hands, staying home, social distancing. That's what's going to fix the problem.
As far as like hospital staff goes, one of my friends works at an ER in Virginia. He's basically accepted the fact he's probably going to get COVID-19. Are you guys prepared for that if there's an outbreak within staff?
Yes, that's a really good question. That's a lot of the work that we're doing right now. We know that there's some preliminary data out there showing areas that are high risk for our caregivers to have a strong exposure. And so we are walking through what does that look like when our caregivers start getting ill, and we need to have contingency plans to back them up. And so absolutely, those are all things that we are actively modeling. I'll tell you that I've been in contact with my peers across the nation, and everybody is working on this collectively, and we're all sharing information and we're sharing models of how to do this successfully. And so it's a great collaborative that's occurring around that for sure.
If one of them were to get sick, the hospital staff member, and this question for you, I'm not sure, would they be paid or would they have to take leave? Have you addressed that yet?
We're actively working through that right now. If a patient or if a caregiver has an exposure, they go home on administrative pay. Absolutely.
Has any staff member gotten sick here yet that you're able to tell us?
We're monitoring that. If anyone feels like they have a concern, we're working with our employee health. But yes, we're just monitoring it constantly.
In terms of restrictions that we've seen from politicians, are shutting down or anything else, or are we all expecting these things to happen to promote social distancing and keep people as long as possible?
I can comment on some things that we're doing from a clinical perspective to try to minimize traffic through the organization. So, for example, we're looking at elective procedures across our organization and speaking with patients about maybe delaying those procedures until we can get through this potential surge period. And looking at even closing down some of our clinics to actually minimize some traffic through there. And again, trying to redeploy our caregivers to other areas where we have more critical needs and need more staffing support. So we are taking measures like that to try to, again, reduce exposure.
On that line, one other thing I want to mention is our visitation policy. And again, this is something that we are collaborating with across the state and modeling after other areas that have really been hit hard with COVID-19. And so one of the items that you're probably hearing about just through social media is visitation. And so again, to Dr. Chanson's point, we do not want people to be unnecessarily exposed. And so we're putting very strict guidelines to protect our community and our caregivers. And so we're really trying to reduce any unnecessary visitation to our patients as well.
So I think to answer that question, I just got off the phone with the governor. The governor has full eyes and ears are on this with us, and we're grateful for that. What we're working on is having a consistent message. We need you to help us with that consistent message, which is what was just shared. But we got to practice the CDC guidelines, good hand hygiene, social distancing, staying home when you're sick, etc., right? That's the first. The second is, if you get sick, what do? You stay at home. If you feel that you need additional care, you reach out by phone or through video visits and talk to a provider. If you feel that you're having the symptoms that were spoken of earlier, with the tightness of chest and so forth and so on, then you need to come to the emergency room and get care, and we can make a determination. But if everybody rushes to the emergency care because they're sick or they're scared, we're going to have a problem. We're not going to be able to take care of the people that need the care. Okay, and then the last thing is just an understanding that the testing is not there right now. There is a worldwide demand. Much of this equipment and testing is in China. That's where it was produced. Okay, you know what China's been going through for the last little while. And then we have the whole world wanting this at the same time. So if people can just be patient with that, the test is not going to determine your treatment. The clinical indications by our physicians are going to determine the treatment if you need additional care. 80% of the people that get this will just either not know it or they'll be able to stay at home, okay? But that's the consistent messaging that we're trying to get out with the governor, with the state health department, with the other health systems in the state, so that people are aware of what to do here. We need the community to cooperate. If the community doesn't buy into this, it doesn't work. And we will be Italy. And then we'll be making very difficult choices as to who gets a ventilator and who doesn't. We want to avoid that. We want to flatten the curve. Your help as a media is really important. I must say also, please be judicious in the way that you cover things. We had a situation recently where there was some change in our visitation policies, and some people didn't like that. And then there was coverage about how they got creative in getting around that. That is not what we need. We need your help to say that's not the way we want to practice. Otherwise, we will have problems in Oklahoma that they need. Does that answer your question?
I know in Tulsa, people liked hearing this, that a person recovered in Tulsa, and we broadcast that. They actually responded well to that. Are you seeing people recover from this in the hospital, or some with severe symptoms?
Yes, around the world, yes. I mean, people do recover. The great majority of people do recover. But if you have a disease that has a certain percentage of mortality, the more people you give it to, the more people are going to die, right? That's just mathematics. So people do recover. Most people do recover. The vast majority of people do recover and are fine. We've all seen, the basketball players that were here. They're fine. They're Facebook Living and everything like that. Most people will be fine, even if they're not a professional basketball player. Most people will be fine. So people do recover, and it's great to hear stories like that. There's a certain amount of testing that goes into defining recovery for CDC guidelines, so they don't say recovered for a while until they tested negative a few times, even though they're not running fevers and feel good and everything like that. So. Yes, sir.
I'd like to just say one last thing. If you could please talk about the heroes that are here behind you and in the walls of the hospital. Our caregivers are amazing. They're the heroes of this generation, and we need to preserve their health and well-being, and we need their support. We need the community support of them. Text, no hugs, but tell them you love them and tell them you appreciate them. We appreciate you being here, and we're happy to answer questions. Our PIO, Maggie Wolf over here, can provide you with information that you need at any time that you need it. So thank you for coming. We appreciate you being here.